Hi, welcome to Davaexplores. Today we are talking about prostate cancer, also known as prostatic carcinoma. But first of all, please like my page, comment, share, and subscribe. Okay, thank you. So, prostate cancer is a cancer that grows in the prostate of men. It's actually found in men, yeah. So, what someone may ask what cancer is? Cancer is a disease in which some body cells grow rapidly or grow uncontrollably and then spreads in what other parts of the body. So, what is the cause of this cancer you've been hearing and the prostate? So, this cancer begins when the cells in the prostate develops changes in their DNA cells, and these cells contains instructions telling the other cells what to grow rapidly. So, when they grow rapidly, they grow than the normal rate at which cells are supposed to grow. So the normal cell starts dying off, and then the abnormal one accumulates. When they accumulate, they form a tumor, grow as a tumor. When they grow in that way, when it invades in the tissues of the prostate, it metastasizes. That's how we call it, and meaning it spreads to other parts of the prostate, which will cause what? Cancer. When you have this prostate cancer, you'll be thinking that you'll be feeling some pains. Maybe you want to be thinking like you'll be feeling or going through some symptoms. Okay, so at the early stage of this disease, you don't feel pain because actually it's benign at the moment. Yeah, it's a tumor, so literally it's benign by then. But when it's malignant, that's when it becomes what? Cancerous. So someone will be wondering, at the early stage, you are asymptomatic, and then you don't show any symptoms. But when it starts growing, as time goes on, you start feeling some symptoms like you're not able to urinate because literally the prostate, we have the prostatic urethra where the prostate is found. So at that site, it can narrow the tube of the urethra in the sense that you can't pass out urine well, and you have frequent urination because your prostate becomes enlarged, it becomes big, and it's narrowing the tube, and it's actually putting pressure, it's pushing your urinary bladder on top, so you urinate frequently, and you have urinary incontinence. Someone will ask, what is urinary incontinence? Urinary incontinence is the unintentional loss of urine. You don't even feel the urge to urinate, but the urine just leaks. Maybe when you are doing a strenuous activity, you're lifting something, you just feel that a urine leaks out of your body. You go through that, and then nocturia, which means urinating at night. So you wake up at night, you urinate frequently, and then when this tumor metastasizes or spreads to other parts of your prostate, this is when you start seeing blood in your urine, which is known as hematuria. You actually see urine in your blood, and you have erectile dysfunction. We know the prostate secretes some seminal fluids to nourish the semen and all that. So imagine having this disease. How I was to have a good erectile function. Okay, so who is at risk? Who is at risk of having prostate cancer? So our old men, 50 years and above, they are at risk of prostate cancer. And then also family history. When in your family, let's say it's not just your dad directly, but when it's a family history, it means, let's say your granddad, your great grandfather has or has ever had prostate cancer. It's likely to be passed on to the new generation or the new men being born in the family actually. Yes, so when there's a family history of prostate cancer, you are prone. And then also, when you are obese, you are fat, yes, you are also at high risk of getting prostatic cancer. But right now, we're going to talk about the complications. When this disease is left untreated, or you don't realize it at an early stage, what are some of the complications? What's some of the things you actually go through? So literally, it's going to spread to other parts, not to other parts of the prostate, but it can spread to the urinary bladder, affecting it, and it can also function well, and it can spread to your urethra. You can't urinate well, like you don't even have the urge to urinate, or you just leak urine unintentionally, and also erectile dysfunction as well. Okay, someone will be thinking, so after all I've said, how are we going to prevent this disease? It's a serious disease. You really have to know how to prevent, but there are no non-preventive measures, but there are some lifestyles you can actually follow to prevent this disease. So we are saying that to prevent all the lifestyles to follow so that you don't have a high risk of this disease is to choose a healthy diet. Let's stop taking these fatty foods. Too much fat is no good. Let's choose healthy foods. Let's eat fruits and vegetables frequently. Let's take in a lot of water, and also let's avoid taking the supplements. Like, oh, when I take supplements I feel good, maybe, yeah, those things, they are just no good. Maybe if you are doing something fine, but taking it too much is very bad. So let's choose a healthy diet. Let's take in more green leafy foods, boosting our immune systems, more fruits and all that. That's good actually. It helps prevent your risk. At least even if you have a family history, you are going to prevent your risk by doing all this and maintain a healthy weight. Always try to exercise on a daily basis. At least in the morning you wake up, a little exercise. You're about to sleep, a little exercise, and don't eat late at night. You eat good food rich in nutrients. You eat foods rich in vitamins and all that. And the moment you start seeing some signs and symptoms, please kindly see your doctor. Don't wait for it to become serious. And I would advise you as a man to always go for what's a medical checkup frequently. It's going to help you because you don't know when it's going to the cells are going to start misbehaving. Actually, that's what I'm going to say it, but I would advise you that you should take good care of yourself and always see your doctor or always seek medical attention. Okay, so let's actually share this message to all our friends. Let's share this video so that everyone can have an advantage. So even if you're a lady and you're watching me now, I want you to advise maybe your friends, your male friends. Maybe you have a boyfriend, you can actually advise him for your own good. Yeah, your husband, you can advise him. Always check his diet since you're the one cooking the food for him. Okay, so thank you very much for watching this video. Don't forget to share, don't forget to like, don't forget to subscribe and follow my Instagram page as well. Thank you very much. See you next time. Bye.